Hello, I'm Dr. Dennis McKenna. Welcome to another edition of Inside Albany Med. And I'm so pleased today to be joined by Alana Rozansky. Alana, great to have you here.
Great to be here.
Now, your title, which we'll talk more about, is you are the System Director for HIM. Let's unpack that, first of all. What is HIM?
HIM is Health Information Management.
Okay.
And so we oversee medical records. We do release of information, birth registry, scanning, auditing, EMPI, data integrity, all great things to make sure the doctors have what they need, the patients can see what they need to see, all good things.
Yeah, for sure. Now, one of the things that I've often said about HIM is to put it in terms that the public may understand is you help the patient tell their story, right?
Absolutely.
So all the information that resides in the medical record is often information that the patient has told to their providers. And it's really important that that information be in a way where future providers can access it so it's portable, right? So they can take it to other providers. So take that a little bit more. You talked about birth registry, for example.
Yes.
What's involved in making sure that that information about the birth of the baby and what happened is information that's available for their entire life?
So we make sure we have a system team. They do this for all of the hospitals except for CMH because CMH was moved to the system team, which is great. They make sure that the paperwork is accurate, that the paperwork is sent in timely so that the baby can be registered and have everything that they need to get rolling in life. They also make sure that the parents know what they need to know before they leave the appointment so that they aren't confused in the process of the state when they leave.
And inside that obviously is medical documentation, but there's a lot of legal things in there. There's a lot of records that the state matches. So it's really important that this information be captured correctly, accessible, but all by way of saying that that's really important work in just birth registry.
Yes.
And then you mentioned a couple other areas. Talk about another one that your team oversees.
So we oversee release of information.
Now that would be an example of I'm a patient. I might want to see a different physician. I might want to take my records with me because I'm moving to Nebraska or whatever. I want to be able to get copies of those and bring those with me.
Yes.
Happens all the time.
All the time.
It used to be you went in and they made photocopies of the record.
Correct.
Now my guess is a lot of it's done electronically.
Yeah, it's done electronically. It's done through MyChart. It's done in work queues. We're able to do it, over the phone, PDF fillable forms, right through the webpage. So much easier, so much faster. Our department went from, I like to say, complaints to compliments.
Oh, that's wonderful. Now, a lot of people may not know this, but as a health system, when we made the investment to put in one medical record, Epic, which we now have across the health system, we moved from 14 different medical records to one. I assume you and your team were intimately involved in the build of that so that it serviced the needs and the patients who want their records in the future.
Oh, yeah.
Talk about that.
So we worked with John Rogas' team also on the archive, but on the front end we worked for the data conversion to make sure that everything was called what it should be from the legacy software into our new EMR. We made sure to the best of our ability that the doctors had what they needed to treat the patient that day so they could stay in one system. And then so we could get our patients what they needed quickly to do what they needed to do, whether they needed to move to Nebraska or see another provider.
Now, you actually said this, so I want to go back. You said you moved from complaints to compliments.
Yeah.
I would imagine that the new system is much more agile, and people who want to get access to their records now, in some cases, they can just do it on their own through MyChart or through the portal. But when they need the assistance of that and you are able to get them that information, I'm sure that's got to be a great sense of relief. Like you've helped them tremendously.
Oh yeah, so we get compliments from patients all the time. So when I got here, we didn't have email. We didn't have a phone tree that directed people places that made sense. We didn't have Care Everywhere, CareLink. We didn't have MyChart. And so now we have all these wonderful ways to get to us really quickly. We have voicemail. We have ways that we can communicate and deliver records, making it easier on the patient, less time consuming. So they can really call and we can move quickly.
You said the words when you got here, so I want to kind of go there. Now, if we were chatting a little bit earlier, you're currently working off the Albany campus, but that wasn't always the case.
No.
You are in the system, and your title is a system title overseeing multiple campuses, but you started on another campus, correct?
Yes. Yep. So I started as the HIM outpatient practice manager at Saratoga Hospital.
Right.
And so I worked really closely with Carolyn Hastings, my now boss, and Sherry LaBelle, the other system director. And we built Epic and all the things with other people. And she reached out to me when a position opened up as a system manager for ROI and asked me if I wanted to take that department on, improve it, get it ready for Epic. And so my first day at Albany was actually go live.
Go live.
Which was so great, good kickoff.
Right.
And then shortly after that, she promoted me to this role.
Wonderful.
And we've been systemizing and moving forward ever since.
I love that. And I think it underscores a point that I've made many times. And so actually a couple points. So let me kind of pull those out a little bit. The first is that when we think about what we do as a health system, the incredible mission that we have 920 unique jobs here at Albany Med, right? And we always talk about the value of everybody's role, clinical and non-clinical. So you work in what I think would traditionally be described as a non-clinical role, but it's clearly vital and central to everything we do with our clinical care. So that's number one. Number two, when we look to find talent and to move people into new positions, often those people might come from the Albany campus where they've been here for 5, 10, 15 years, but not always, right? So we are now a system, Columbia Memorial Health, Albany Med, Saratoga Hospital, Glens Falls Hospital, visiting nurses. Each one of those campuses has incredibly talented people like yourself, who from time to time might be involved with projects with other individuals. And so finding those people and giving them system titles occurs on all the campuses.
Yep.
And you're a perfect example of that. And coming from Saratoga Hospital, which is obviously a fantastic hospital in and of itself, gives you a perspective of what the needs are, not just on an academic campus like Albany, but what community hospitals need.
Yeah, absolutely.
And you already have those relationships. So I just think it's a great story to illustrate the systemness of what we're trying to accomplish.
Yeah, coming from Saratoga really, really helped me be able to move things forward from a system perspective.
Right.
So obviously we aligned the jobs. ROI was where I did this first, release of information. And so we took users from each campus who were really good at that task already. And being a part of Saratoga so recently, I was able to stand that up and move forward so quickly because I already knew the key players. Everybody was engaged, we had buy-in, and we were able to stand it up with ease.
So what's your secret sauce, right? Because in order to do that work, that's not easy. I mean, you're making it sound easy because you're probably a humble person, but in reality, when you get different campuses that have done things differently for many years, sometimes somebody wants to go one way, sometimes someone wants to go another way. So how do you create an environment where you get people to agree that we're going to do it on this way, and which means by definition some campuses have to start doing things differently? How do you facilitate that type of work?
Two things. First, I really, really, really invest in the feedback from my employees. So when we were building that department, I sat down with them once a week, sometimes more, especially when we were first building it, and said, what are your pain points? What keeps happening? What can we prevent? What can we improve? And they gave me incredible, constructive, wonderful feedback, which led to the flyers, the intranet, the internet, the system PDF fillable forms. I couldn't have done it without them. Then I took that fantastic information of their pain points and I brought it to local leaders and critical departments, and I told them, we have this huge problem, it's affecting patients. What can we do to work together to get this done?
What I love about that is that you were problem solving with the patient as the central area that you're focused on. If we can fix this for the patient, then we can all agree that that's important work to do.
Yeah, and it makes systemization so easy because if you bring everybody back, it doesn't matter whether you work at Saratoga or Glens Falls, we are all here for that patient, and getting them what they need as quickly as we can possibly do it with high quality is what we're here to do. And I think we can all agree on that.
Absolutely. In the system, one of the things that we're doing right now is we're partnering with ECG. This is a healthcare consulting firm that's going to work with us to help us set the strategy for the health system for the next 5 to 10 years. Inside that, there's a couple different work streams. One of them is looking at corporate services, and inside that, obviously, is the work with HIM. Have you met with ECG yet? What's your sense? And if so, are you excited to do that work?
Oh, I'm so excited. So we actually met with them this morning as an HIM team. So we had coding there, CDI, HIM, and we just had such a lovely conversation. They asked us about our pain points and what we can do to become a better system and get things to our patients faster and better. They also asked us about what we did, and so they could understand. And then we're going to do individual interviews tomorrow so that they can learn more about what we do. But they were fantastic. I look forward to hearing about what they've done other places. There's a lot of things that I hope that they can tell us what best practices. There's things that we're doing right now. And we've tried our best. And I think that there's a lot of things that we can maybe do better.
No question.
And if somebody else is already doing it and they can share that knowledge with us, I would love to take it.
That's exactly right. They've worked with Cleveland Clinic, they work with Mayo, they work with these other organizations. They want to take us from forming a system to performing or being a high-performing health system. And you're right, they have best practices and they've done this work before. And we'll take the foundational work that we've done, putting in one common medical record as an example, and now turning to them and saying, with this, now what can we do better? So thank you for doing that work. Thank you.
Yeah, they're lovely. I'm excited for them.
Now, I think there are at least 3 things I can think of as I'm sitting here that we have in common. So the first one is you and I both love working inside Albany Med. I get that sense from you, which is wonderful. The second is I think we're both dog people. So I love dogs. I think you love dogs.
I as well. I have 3.
3. Now, what breed are they?
I have a Great Pyrenees. That's a troublemaker. Loves to eat drywall.
Named?
Cheddar.
Okay, excellent. Because people are going to want to know the names of your dogs. What about the other 2?
Ollie, a border collie mix.
Got to be brilliant.
Oh, so smart. Also
Border
a table
collies
surfer.
are,
He knows his right from left. Very impressive.
Right.
Very impressive.
Right.
And then lastly, we have Maple. She's an Australian Shepherd mix.
Oh, yeah.
She is, she's a double wide. She's turned into an Ottoman. That's our fault. That's our fault. We've loved her too much.
Yeah. Do you know who also is a fan of Australian Shepherds is Dr. Alan Boulos, actually.
Oh, really?
So, yeah, when you see him, he has Aussies as well. So,
I'll have to talk with him.
Yeah.
So much energy.
Yeah. And speaking of energy, you are also someone who I think does CrossFit. You're very active.
I do.
Talk about that. How is that? Does that help you from a physical, from a mental health? Like, why do you do it?
I do it because it keeps me sane.
Yeah, likewise.
It keeps me calm. It keeps me normal. And also, nothing better after sitting, for most of the day to go and get some activity.
So you do most of it in the evening? You're not one of those people who's there at 5 a.m. You do it in the evening?
Oh, no, I'm not. No, I'm not that particular flavor of crazy, no.
But you do enjoy it, and there's a whole community that you work out with and do that thing?
Yep, I work out at CrossFit Schenectady. They have Olympic weightlifting classes. They have daily classes of sorted hours.
No stranger to the kettlebell as you.
No, but I do love a good barbell.
Yeah.
I'm a big fan of the clean and jerk, so I highly recommend if anybody wants to get a workout in to go to a local CrossFit. Sorry, I am one of those people.
They definitely have a certain personality, but that's good. It's good that you're passionate about it. I mean that sincerely, right? That's great. I get that sense.
Oh, you know what else we have in common?
What is that?
So I actually was in dentistry for 12 years before I was brought here. I actually did your daughter's braces.
You did my daughter Kate?
Yes.
Is that right? Well, so all of our children have required braces at various times. That's interesting. So what did you do in dentistry? You were...
So I was
working in an office that did braces?
Yeah, I was a team lead at Albany Braces for 6 years.
Yes, that's where they went.
Yes, and I put braces on, I put appliances on. A couple of providers who work here now, your kids have thrown up on me, and they're lovely. Well, you don't get bit anymore, so that's nice.
Well, my daughter actually has beautiful teeth, so you must have done a wonderful job. So thank you, and I'll make sure I tell her about that today when I see her.
Oh, well, lovely. Yes, and your wife is also an angel.
Karen.
She's so kind.
Good.
I enjoyed talking to her a lot.
I'll tell her you said hello as well. Let me kind of end on this note. If you were to talk to people who are thinking about coming to Albany Med to work, or people who are here now, what would you say to them as far as the value that you feel personally with the work that you do?
Oh, I could have never predicted where I would have been. So I'm a graduate of Clarkson University
Excellent.
in the area, and they actually bring me back to talk to students all
Oh,
the time.
that's great.
And what I always tell them is to apply for things that interest you, and definitely I always encourage them to apply here, but you never know what you're going to love, and I cannot tell you how wonderful it is here, how fantastic and collaborative and just encouraging everybody is. The culture, just everything is just so wonderful here. I've worked many different places in the area, and I've just never felt more welcomed than I do at Albany Med.
Well, that's wonderful to hear. I think you and your team do a very important job, as we talked about, across the health system. So thank you for that. Thank you for being a wonderful ambassador for us. Thank you for talking to those students out there at Clarkson and letting them understand that there's opportunities to work here in the system. And thanks for taking the time to talk to us. And I'm sure a lot of people are going to enjoy learning about what you do and your team does. And thank you for being part of our team here at Albany Med.
No, thank you.